Hello everyone, this is Dr. Oscar Moreno, registered Chinese medicine practitioner. I would like to speak to you today about a series of videos that I'm going to be making about chronic fatigue syndrome, particularly the Chinese medicine point of view, including the concepts involved, the ideas involved, different types of treatments, different strategies involved. Um, there are many aspects that we can talk about, so there's going to be a series of different videos involved here. Obviously I cannot put all the information in one whole video here, but I would like to start this video with an introduction of what could be chronic fatigue syndrome in both modern times through Western medicine knowledge and ancient times Eastern medicine knowledge. Currently in the modern side, there's still not a well-defined diagnosis idea of what it is, but what we know is that this is an inflammatory reaction. This can be seen in the work by Breno et al., where they talk about inflammation as a big key point and immunodeficiency scenario, particularly that corresponding to a hyperimmunity type context here, in which the immune system just becomes aggressive, continuously, hence a chronic inflammatory picture. In regards to this, there's different aspects involved where the problem can come from. But of particular importance is an aspect that we call myalgic encephalopathy. That is, an inflammatory reaction has affected the brain and created different dysregulations in terms of how the brain will work. And also in terms of what could be called a HPA axis dysfunction or a neuroendocrine dysfunction related here more to adrenal fatigue type patterns, which are also part of the work expressed here by Rode et al., where they definitely identify these mechanisms as part of this disorder. However, one thing you can tell is there's still not a general consensus, not a full-on defined vision or diagnosis of it. I personally believe it's because there's many different aspects involved and can have different peculiarities, different patterns involved. If you guys want to know a bit more in terms of how this could happen, this chronic inflammatory reaction, I will recommend you to read the book Mould Warriors by Dr. Richard Shoemaker, where he explains well the mechanism of what he terms CIRS, or chronic inflammatory response syndrome, and how an inflammatory cascade can become out of control. This is written, the name of the book and the details, in the reference list at the end of this book. And I think, in between these three examples I mentioned, it can be clear that we're looking at an inflammatory presentation that is hard to control, and hence, if it's not identified properly, it might render all these fatigue type scenarios. This is more the modern part that we see. I'm not going to be talking a lot about the modern knowledge, as this is there's a lot of info out there on the internet. I want to talk more about Chinese medicine, right? In Chinese medicine view, we actually hold the same idea that this is a chronic inflammatory reaction. This has been already observed throughout different times. For me, where I heard particularly about this the most is through the works of Li Dongyuan around 100 years ago, in his classical book called The Treatise in the Spleen and Stomach. He mentions here the concept of clear yang qi, as in vitality, and the concept of fire and heat as inflammatory reactions of different sorts or different presentations. The main key point here is that fire or heat are the enemies of clear yang qi. So he already identified that inflammatory problems were going to make a person tired all the time. And for that, he actually has a good number of different herbal strategies in his classic for those that are interested, that are practitioners there. In addition to that, one of the main books in infectious diseases, the Wen Bing Shui, or warm pathogen diseases, not only analyzes the fatigue coming as an inflammatory reaction, but it actually analyzes different aspects, different presentations that can vary quite a lot in this context. And for each one of these presentations, they actually have different treatment strategies. So I personally believe these guys were already more advanced in terms of what we're looking at. So I strongly recommend for those practitioners, modern or of modern medicine or Eastern medicine, it's very, if you're working with chronic fatigue syndrome, really look into the ideas involving the Wen Bing Shui. And if you analyze the herbal strategies, they really, particularly anti-inflammatory strategies and anti-infectious strategies. And I want to bring here a very, very strong key point that both the ancient people and modern people analyze. This could be strongly related to infectious diseases. Not all the time under my personal experience, as most of my practice is in infectious diseases and chronic fatigue syndrome, but it seems to have strong correlation in it. Probably 95% of patients I've seen have told you, usually tell I remember picking up this infection or feeling like this or being in this country and something in the gut or something respiratory, something viral, and never been the same again. That's a very common story in the works that I mentioned before from modern medicine. That's also a standard key point they raised, and it's also a standard key point within Chinese medicine. Those we can see, we both in modern and ancient times, we're looking at inflammatory reactions related to an immunodeficiency issues, related to chronic infections, or not chronic or acute infections. Usually what I've seen is more with chronic infections. And in moving more in the modern sense, we're looking at this myalgic encephalopathy kind of name giving into it, which also is associated with different presentations in Chinese medicine. Talking in terms of Chinese medicine, I've been mentioning ancient practitioners, but even in modern times, this is a particular strategy utilized by many practitioners, including myself, from which I've learned from other more older doctors or people more involved in this area when I was getting started here. Interestingly, Professor Shui from Yangnan University in China, he talks about very similar treatment strategies, very similar herb approaches, where they're putting a lot of anti-inflammatory strategies and anti-infectious herbal strategies. Thus, he's definitely following the ancient methods, but I think he also brings an idea of a modern method involved, or just to corroborate his ancient strategies. He also will utilize this in a modern fashion with mixing it, in integrative medicine. Hospitals in China, they'll have access to novel medicine testing to check for inflammatory levels, and they will put that together with ancient strategical methods, which is part of what we do in integrative Chinese medicine, mixing together modern testing with ancient strategies. Anyway, guys, this is just an introductory video. I've gone a bit past already the time I wanted to go through, so I'm gonna stop this video very soon, but I hope it gives you a brief idea of what we're looking at in terms of what chronic fatigue syndrome is, what adrenal fatigue syndrome could be termed, or what the mechanisms are, the different strategies or approaches involved. And once again, in the future I'll be talking more about this particular aspect and making shorter videos. This is a bit longer due to the introductory aspect of it. Thank you so much for your attention. I really appreciate your time listening to me. If you have any questions, you can send me an email in www.oscarmoreno.com.au. I repeat, www.oscarmoreno.com.au. And once again, thank you so much for your time, and I'll see you next time, guys. Bye bye.